The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our technical producer who's going on vacation for 2 days next week, J.D. DeAndes. In the studio with me is Brad White, a compounding pharmacist and vice president of Medicine Center Pharmacy, and our very special guest, Dr. Priya Ramaiah, a gynecologist and robotic surgeon at Total Women's Care. Good morning, doctor. Welcome to the show.
Good morning, Paul. Good morning, Brad.
Okay, studies show that somewhere between 25 and 45% of postmenopausal women find sex painful. Estrogen, Estrogen, the primary female sex hormone, regulates your reproductive system. Before menopause, estrogen helps maintain the thickness and elasticity of your vaginal tissues. However, as you age, your estrogen level drops, causing changes to these tissues. When vaginal tissue grows too thin, sexual activity can become painful. Our topic today is women's health with a focus on Mona Lisa Touch, a promising and exciting hormone-free treatment. We'd like to remind our listeners today that our program is available on our podcast, which can be downloaded from the App Store on your mobile phone. You can look for Health Matters with the Medicine Center Pharmacy and listen to any of our programs anywhere you go. If you have questions you'd like addressed today, you can post them up on our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
So, Dr. Ramaiah, take a moment, please introduce yourself and tell us about your practice.
Thank you, Paul. I am an OBGYN physician. I've been in the area for almost 3 decades now. I came here after finishing medical school in India, and I came here to Altman Hospital for my OBGYN residency. And as I finished, I found a good opportunity to settle in the area, raise my family, and I have been here since then. Of course, I'm board certified, and I initially did both OB as well as GYN, taking care of women of all ages. But in the last 10 years, I took a step back and gave up the practice of OB and have since focused my energy towards GYN care. I am a health advocate through the different stages of life for my patients. Still, after 25 years, I consider my work my passion. I'm as enthusiastic about what I do today as I was at the beginning of my career.
Okay, so what's different about your practice?
You know, we're all trained in medical school in the allopathic system of medicine, which is very much about the treatment of disease after it occurs. In fact, unfortunately, in medical school, we do not even have any training or emphasis on the prevention of disease. This, I think, is the biggest drawback of our health system today, where we are not actively promoting wellness and thereby preventing or limiting disease. Fortunately, being in women's health, I see a lot of women before they have any serious ailments. So my goal, I see myself as a health advocate through the different stages of life. I am in a unique position with my patients whereby we have a relationship that is established that I can advocate for them, be their guide, helping them achieve their optimal potential, both in terms of physical as well as mental wellness. This I consider a privilege and an honor. Physicians oftentimes are in a rush when they see patients, and let's be truthful. We really don't have too much time to educate, and this I believe is where my practice, Total Women's Care, fills a much-needed void in not just being able to treat disease, but also to prevent disease.
What about alternative medicine? How do you work this into your practice?
So through the course of my medical practice, after many years of practice, I began to see that there was something missing about allopathic medicine. Even all the prescriptions we offered had various side effects or didn't quite address the situation or the problem. So therefore, I began looking at alternative sources of treatment, of helping. And so, being my background being from India also, I began looking into non-alternative medicines, including Ayurvedic medicine, herbal medicines, and some naturopathy also. So I started dabbling in that, offering some suggestions to patients just as an aside. And I found that more and more people would come back with such positive comments about how much it helped them that this encouraged me to reach out and study medicine, other forms of medicine in a more formal environment. And although I'm not a naturopath, I do use a lot of herbal remedies combined with diet, herbal supplements, along with allopathic medicine. So I think that my background in allopathic medicine actually puts me in a good place to kind of bridge the gap between allopathic and alternative medicine.
What about what's going on in India as far as treatment? You haven't been there in a long time. I understand, because you've been in America for a long time. But what are they doing?
It's actually sad because the West is reaching out more towards the Eastern and Occidental forms of medicine versus in India. They're kind of abandoning the older systems, the ancient systems of medicine, and going towards more of, overprescribing antibiotics, treating every single ailment,
Interesting.
And so while we are reaching more towards the East, I think the East is kind of reaching more towards the West. And I think there's going to be a point where the pendulum is going to swing back.
Well, it's interesting because there's a fair amount of manufacturers in India that manufacture prescription drugs.
Exactly.
Dr. Reddy is one of them, isn't it?
Interesting.
I don't know. So
he's big. He's big into generic medicines.
I know. Yes. I know. Big time. So they're all coming here, or are they using them there?
A lot of them are coming here, but there are a lot of locally produced allopathic medicines there too. Yeah, there's a wide range. In fact, they follow the British pharmacopoeia. So they have a lot of medicines that are used in the UK that are not used in the US.
I see. Okay.
I understand that you're a bioidentical hormone therapy specialist. Can you explain that to our listeners?
So as I was saying, I found that allopathic medicine somewhere along the line somehow missed the mark. And I had a few patients that did not quite follow the prescription drugs that we can get at regular pharmacies. And so I began looking for solutions and answers, and I found that there were some people that benefited more from a more customized approach where the regular estradiol or regular hormones didn't quite work for them. And so I started to look for solutions. And, this is where I think our compounding pharmacists are a very great addition to our team work, where we can work with compounding pharmacists and provide unique and customized solutions, not just for menopause or hormone replacement, but also for other chronic ailments that are not very amenable to allopathic medical therapy.
Well, I want to take a second out. I get a question a lot in the pharmacy about what's a compound? And so for our listeners that aren't familiar with special medications, a compounded prescription is really neat. It gives us at the pharmacy with special tools and training to help customize a prescription for an individual patient based on exactly what a physician like Dr. Ramaiah wants. So often commercially available doses don't work perfect for a patient. Maybe you have an allergy to a dye. Maybe you have an allergy to a filler. Maybe you have trouble swallowing and you can't swallow a capsule. So there's a lot of different ways that we can customize the medication to go in a dosage form that will help it work better in your body for your treatment based on exactly what your physician wants. So I'm proud to say that our pharmacy in Tuscarawas County was one of the first 2 pharmacies in the state of Ohio to be accredited by the Pharmaceutical Compounding and Accreditation Board. And we prepare non-sterile medications there, so we can make capsules and tablets and creams and ointments and gels and lollipops and lip balms and suppositories and all kinds of neat dosage forms to help doctors get doses into patients to help them with their problems that they're suffering from. So, Dr. Ramaiah, how does customized compounded medications expand your treatment options?
That's a great question. Allopathic medicine assumes that standard doses should suit everyone, and this may not be the case. So therefore, I think compounded medicines play a significant role. However, in order for compounded medicines to work, one has to have a reliable and ethical compounding pharmacist who's an essential partner and colleague in providing safe and pure medications. I use compounded medicines not just for the management of menopausal symptoms, including hormones, estrogen, progesterone, testosterone, also steroids, but it's also helpful for the treatment of specific ailments that may need customized combinations of medicines that are not available in allopathic medicine. For instance, the testosterone in allopathic medicine is made for male doses. It's not available for women. And so by necessity, we have to compound it if we want to provide any kind of androgens to women. I often use a combination of allopathic prescription medicines along with herbal supplements and compounded medications as needed to resolve different issues.
Well, very good. It's really interesting, the journey with hormone replacement therapy, because the standard of care has changed quite a bit in the last 20 years. Can you describe how HRT can benefit a patient today?
HRT has been endorsed by our American College of OBGYNs as a safe alternative and primary therapy for relief of perimenopausal and menopausal symptoms. However, they do caution and encourage practitioners to use HRT for the shortest duration possible for the short-term relief of menopausal symptoms. So what happens after? What happens way into menopause, way past menopause when women are still suffering? And that's why I think compounded therapy using the knowledge base of allopathic medicine and a reliable compounding pharmacist, I think, is an ideal team approach to help with this issue.
Excellent. Okay. First break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you sick and tired of waiting at the big chain pharmacies for your prescription? We've all been there. You aren't feeling well, and you go to pick up your prescription, and you're told to come back later. At the Medicine Center Pharmacy, you don't have to wait. We can fill your prescription in 15 minutes or less, and we could even save you some money on your prescriptions. Talk to your Medicine Center pharmacist at any one of our locations in Canton, Louisville, Minerva, and New Philadelphia. Visit medshoprx.com for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Spring is finally here. It's time to beautify your home with stunning stained glass. Studio Arts and Glass will custom design a traditional bevel glass window or add elegance to your contemporary space. The gift shop's open Monday through Saturday from 10 to 6. Call 494-9779 for our stained glass class schedule or to make a live succulent wreath. Go to studioartsandglass.com for more information.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. A locally owned Health Mart pharmacy, whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing women's health with Dr. Ramaiah. Have a question? Give us a call at 330-450-1480.
All right. Well, I think this is probably going to be an exciting part of the show for you because I want to ask you what exciting developments are going on in your field.
Very good question. Actually, a couple of things I'm really excited to talk about today. One of them is the procedure that Paul alluded to earlier in the program, Mona Lisa Touch, which is a revolutionary technique that has been adequately trialed and vetted in the U.S. now. And the other one is, of course, robotic surgery, which is a little bit earlier, but still not that old. And these two, I think, have really revolutionized GYN health services today.
So, robotic surgery, you have to go for special training.
Yes, that is
correct. And is that here or is it elsewhere? Or?
So there are 2 parts to the program, and it's very carefully monitored in order to ensure that we get adequately trained. And there's actually a live session or a session with a live animal lab in the animal lab, and then also there's proctoring. And then you have to maintain so many procedures every year in order to be able to maintain your privileges. So it's kind of a tight system where your skills are monitored and to ensure that you have the quality.
So how does this fit into your practice?
Well, I'm a GYN surgeon, and as a surgeon, I do surgeries on women with women-related ailments. And in the past, one of the commonest procedures in the U.S. still is a hysterectomy, and the vast majority of procedures were being done abdominally through a large incision. And I remember way back when my grandmother had a hysterectomy, we were in the hospital for 10 days.
Wow.
It was fun for me because it was like a picnic at the hospital, but I recall that she was basically an invalid for a few months thereafter. Well, times have changed, and so with the influx of minimally invasive surgery, including robotic surgeries, people can have the surgery done with very small incisions, which translates to a much smaller recovery period, where they're able to go home almost the same day or the next day and get back to work within a week, 10 days. And in fact, I myself underwent this robotic surgery over my Christmas break. And I was back at work within a week, and it was just amazing to me how quick the recovery is.
Very. It's Da Vinci, right?
Da Vinci robot, right.
I happened to see a picture of one, and there was a medical issue of the National Geographic, and I thought, oh, my gosh, what is all this stuff hanging down?
Well, they actually have the entire videos on YouTube.
Oh, okay.
Do they really?
Yeah.
All right. I'll have to look at that.
Interesting.
I just thought it was amazing with all the stuff
It's
hanging
so
down.
neat. I mean, I still get such a high from it.
So what about a Mona Lisa?
So the Mona Lisa is basically a gentle laser therapy that has been FDA approved. It delivers CO2 laser in the office to the vaginal tissues. It's a 5-minute procedure that is requires 3 treatments, about 6 to 8 weeks apart. No anesthesia, extremely safe in experienced hands. And people experience symptom relief after even just one treatment. There's no downtime. People walk in themselves, take themselves home. There's no downtime in terms of taking time off from work, etc. And there's about a 70 to 80% improvement in not just vaginal dryness, but also relief from painful sexual activity, and also in some instances overactive bladder symptoms.
You may have already answered this question, but who's a candidate for Mona Lisa?
Really, anybody that does not have an extremely large uterus or organ that needs to be removed, that cannot be delivered through the vagina. And that's the limiting factor.
Who named this treatment Mona Lisa?
That is actually, I think, a brilliant...
One of the most famous paintings in the world, ever.
I guess the Da Vinci name was taken, maybe, huh?
Yeah.
Exactly.
And the Mona Lisa was actually started in Italy, by an Italian surgeon.
Okay, well, that makes sense.
So maybe that had something to do with it.
Sure. Okay. What's the success rate on this treatment?
70 to 80%.
Yeah, it's good. Yeah.
And, there was a time, it took me a little while to go after this. I've known about this for the past 4 or 5 years, but I, like all physicians, I was a little skeptical about something new and about the safety issue. And then it was brought to the U.S. by a couple of nationally renowned gynecologists, and they had, so now we have about 30 trials here in the U.S., and it's really validated and quite effective.
Are there downsides?
We have to be careful about selecting the right patients for it, and that's where I think, in fact, in my office, I offer a one-time, no charge, no pressure, no commitment visit where I can assess the patient, and also the patients can get more information about it to see if it's something that they would benefit from. The other downside, I think, is that it is not covered by insurance. But if you compare it to the therapies that you have to use in order to provide relief, it's quite comparable in terms of the cost, and it's much cheaper here in our neck of the woods than on the East and West Coast.
Yeah. Okay.
You've talked about a lot of benefits of the robotic surgery compared to traditional, from faster recovery times and I'm guessing fewer complications. Who are the best candidates for a surgery like the Mona Lisa Touch? Is there a patient that just maybe doesn't fit the mold?
Typically, it's encouraging to use it to get the therapy before there's significant stricture and stenosis. My oldest patient to date is 75 years old, and the relief that she would experience would be somewhat diminished because of the number of years that she has gone through in menopause versus somebody that's just starting to go through the change and is experiencing the discomfort. That would be the ideal candidate. But really, anybody who's not had radiation therapy or who does not have a sling or a mesh is a suitable candidate. The other area that is actually becoming a little bit more prevalent now is, with the increase in nursing. Women are nursing longer periods of time, and with that, there is some decrease in estrogen too, which can also cause some vaginal dryness. So there is a role for that also in the younger women who are nursing and who experience some vaginal dryness because of nursing.
Okay, very interesting. Well, I think one of the things that's really interesting to know is that this is a non-drug solution. So sometimes hormones can be scary, especially if you have a family history. Is that something you want to touch on?
Definitely. There's a large percentage or a population of women that are not candidates for hormone replacement therapy, either because they have some cardiovascular disease or coagulopathy or family histories, or people who just don't want to dabble in hormones. And especially the biggest group that I see that would benefit are large percentage of women that have had breast cancer, have been treated for it successfully, and now trying to regain their normal life back, and they find this is a big, big, big bump in the road. Unfortunately, even our oncologists are not as cognizant or aware of this, and the issue is people think, you've finished surgeries, you're treated with breast cancer, what more do you want? Just go on with your life. And I don't think people realize that sexual physical intimacy is a significant portion of our human psyche, where we do value that there's a role for hugging, kissing, touching, and if you've had a good relationship with your partner, that is something our women do miss. And I don't think we should accept that as, it's okay because you've vanquished cancer, so now you can just go on without it. And I think that's kind of sad.
Okay. Bottom of the hour, time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Spring is finally here. It's time to beautify your home with stunning stained glass. Studio Arts and Glass will custom design a traditional bevel glass window or add elegance to your contemporary space. The gift shop's open Monday through Saturday from 10 to 6. Call 494-9779 for our stained glass class schedule or to make a live succulent wreath. Go to studioartsandglass.com for more information.
Have you seen our new arrivals at the Half Off and Hot Buy store in Louisville? A great selection of spring clothes for men, women, and children. This is a great time to stop in the Half Off and Hot Buys to see what's new. Lots of spring toys, and it's getting close to Easter. You'll see a lot of Easter bunny stuff like eggs, baskets, and lots of Easter decor for the season. So get over to the Half Off and Hot Buy store in Louisville next to the Medicine Center Pharmacy, where our quality choice products are still buy one, get one free. Find us on Facebook, Instagram, at halfoffhotbuy.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are talking about Mona Lisa Touch with Dr. Ramaiah. We've got a lot more to cover this morning, so let's get back to the show. Fatigue and stress take a toll on your health and hinder your quality of life. I understand you use alternative medicine to relieve stress and fatigue naturally. Okay, help us with this subject.
And this is where I think that my personal experiences have guided how I address this anymore, because I went through some of this a few years ago, and allopathic medicine, quite frankly, did not provide me the solutions I was seeking. And so I went, like I said, I went looking, and you know, allopathic medicine for the most part does not even address or consider leaky gut or adrenal stress or hormone imbalance as, you know, as medical conditions. And so I looked towards alternative medicine, alternative therapies, and, you know, truth be told, stress is a significant part of everyone's life. You know, whether you're a third grader or whether you're an adult or whether you're a mom juggling different roles in your life, there is a lot of stress in our lives. And I think this is something that's not going to go away. We can't say, okay, let's just turn off the stress and go back home and sit in our homes. It's not happening. So the alternative would be to figure out how are we going to address or manage the stress. And managing this is key, I think, and not just in terms of handing out a prescription from your pharmacist, but also in terms of addressing how are we living our lives in terms of our environment, our diet, our activity, our emotional, mental well-being. And this is where I think that Total Women's Care, we at Total Women's Care provide a customized, unique solution that addresses the individual differences and needs of patients. And I think all a motivated patient needs is some guidance and some education and some herbal supplements or some prescriptions that might help them manage the daily living stress.
I'm stunned at how many people seek out and get antidepressants from the pharmacy. I personally think you can kind of talk yourself out of it, stress, okay? It took me a long time to figure that out, okay? But I don't think most people can do that.
I think our society is more like, I need instant gratification, you know, and so
fix it now.
Fix it now and give me a magic pill. And there are a lot of my patients that are disappointed when I don't do that. Yep. Unfortunately, that's just a temporary solution, and long-term has its own side effects. And so I encourage women to come in and address these issues where I can be their advocate and their guide and help them find solutions unique for themselves. And really, it's not that difficult. And as a small little changes make huge differences in our lives.
Well, I always kind of thought, you know, if you have a cup of tea, you go for a drive, or you go sit in the corner somewhere where there's nobody else around, or you go for a walk, or all that sort of stuff is really a precursor to try and fix this on your own.
The other big thing is social media, the impact of social media. Right. You walk into any room, everybody has their head buried in a smartphone or a technical device, and they forget that they can talk to each other right across like we're talking here.
Yeah, not through the phone. She's over there, and I'm right here, and I'm talking to her on the phone. Wait a minute. Why are you doing that?
Even my kids, I tell them something, and they'll be like, well, just text it to me. Mom. It's like, wait, what about just talking, conversations,
Yeah, that's nuts. Right.
Well, I think it's great that you support some non-drug alternatives, whether it be good nutrition, or we're kind of talking about things like meditation and prayer and yoga and some different ways that you can relieve that or manage that stress. I think you probably manage stress. You probably don't relieve it because it's always there.
Right.
So, I wanted to touch on your website as a resource, and I'm sure we've had a question already of how do they learn more. So why don't we talk about your website and a contact phone number, and let's touch on that because we've had a question or two on that, so we don't want to. We go by that. So
our website is www.ramaiah, RAMAIAHGYN.com, and there's quite extensive list of services that we offer, and there's information about how to reach us, how to where our office is located, etc. And basically, we provide women's health services through the entire life, except for maternity, be it preventive screening, contraception, PID, endometriosis, period issues, perimenopausal issues, menopausal issues, urinary bladder issues, sexual issues, fatigue, which is a big thing anymore, as we just talked about it. And, I encourage you to come in and look into Mona Lisa Touch, especially if you are one of those women that has been affected by it. And really, you do not have to change your existing gynecologist. You would come to me just for this procedure, but I'd like to see you to make sure that this is the right procedure for you and give you some more information about it. So this way, you could decide if this is the right thing for you.
Would you like to? I'd like to ask you a question about former hormone therapy. Okay, I started in the pharmacy as a period when the estrogens from pregnant mare and all that sort of thing were the big time thing, and oral contraceptives were super potent. And I had a neighbor who just was on the most potent oral contraceptive, just could not stop bleeding. Okay. And over the years, with the conjugated estrogens, we got clear up to 2.5 milligram, all that sort of thing. So how many people come to you that have been through that period? And can you straighten them out physically or help me with that?
That's a great question. Fortunately, we do not have as many women today that had such high doses of hormones.
Right.
And the few that have come through have been, they're almost like addicted to it. So it has been very tough to kind of almost wean them off and put them on lower doses. And it's taken a lot of,
So you can't stop it.
You should not stop it. Oh, no. That would be a worse scenario if you just cold turkey stopped it. No.
Sure.
Definitely needs some medical management there.
Okay. Very interesting.
Okay. What about, do you have can you share a success story from a patient maybe that you're fond of that really helps drive your passion for the procedures that you do on a daily basis? Because one of the things that I enjoy in the pharmacy is when you have a patient come in, or even their spouse, and thank you for giving them their life back. I mean, it's so rewarding.
Right.
So do you have one that's near your heart that you can share for our listeners to help them understand what's possible?
And I have to say that even though there's a lot of talk about physician burnout and physicians not really engaging or enjoying what they do anymore, maybe because it is my field where I feel like I can actually provide solutions and improve life. And as opposed to like maybe in internal medicine, you can only manage hypertension or manage diabetes, but you can never cure it. So, using my armamentarium of both medical as well as surgical services, I think that I feel very fortunate that I'm able to actually bring some degree of success to patients' lives. And, I think of medicine as both science and an art, and the science is what you learn in medical school, but, actually going forward in your own practice of medicine is where you figure out the art of medicine, which is not just handing out a prescription, but also engaging with patients and communicating with them, understanding their expectations and providing practical, suitable solutions, at the same time keeping them safe. So the Mona Lisa touch is probably what I'm really most excited about. It's been only about 3 or 4 months since we started it, but already I have seen such a huge impact where women have come in and told me, I didn't think I had a life after breast cancer. I had vanquished breast cancer, but here I was stuck. And then another lady came and said she was not breast cancer patient, but she said, I didn't feel that same closeness with my husband, and he felt that I was actually angry at him because every time he came near me, my libido was rock bottom because I could only think about the extreme pain that I was in. Mm. And actually one spouse came in and said, thank you so much. I feel like our relationship has improved again. We were on the verge of separating. Mm. So, those are all some success stories that I'm so proud of.
Well, what about I have a friend who, business associate who had breast cancer. She's had reconstruction surgery. She's happy and everything's good. Bingo, the daughter shows up with it. Same thing, same deal. Mm-hmm. Where are we on genetics and breast cancer?
It's very exciting, Paul, anymore because unfortunately, we are finding younger and younger women with breast cancer, and but fortunately, we also have a large number of tests that can be offered. We talk about BRCA1 and 2 being the big genetic markers, but truth be told, there are actually some 5 or 6 other genetic markers that are way more potent in the incidence of breast cancer, or the risk for breast cancer. And so that's one of the services I offer in our practice, also women who have had a family history, to see if they're candidates for additional genetic testing and suitable management going forward to prevent rather than to diagnose early and treat. Prevention is huge. It's a key.
So 2 questions. Traceable, have we done a study on women with breast cancer as to where it came from? Why do they have it? Why did they get it? Is it diet? Is it genetics? Mm-hmm. Is it, all that stuff? Okay.
Paul, if we had a straightforward answer as X is equal to B or Y, we would be fine. But the problem with cancer, as with most diseases, it's not just one single A equals B type of equation. There are multiple factors, including diet, including genetics, including lifestyle, including your personal situation, and there are risk factors that increase those things. So just because you have a genetic history, it's still not 100% chance that you're going to get breast cancer. There's a significant chance, but it's never 100%. So there's not one isolated factor that you can say is going to cause breast cancer. Life isn't 100%, unfortunately.
I'll get my second question after the break, okay? You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Have you seen our new arrivals at the Half Off and Hot Buy store in Louisville? A great selection of spring clothes for men, women, and children. This is a great time to stop in the Half Off and Hot Buys to see what's new. Lots of spring toys, and it's getting close to Easter. You'll see a lot of Easter Bunny stuff like eggs, baskets, and lots of Easter decor for the season. So get over to the Half Off and Hot Buy store in Louisville next to the Medicine Center Pharmacy, where our quality choice products are still buy one, get one free. Find us on Facebook, Instagram, at halfoffhotbuy.com. Are you sick and tired of waiting at the big chain pharmacies for your prescription? We've all been there. You aren't feeling well, and you go to pick up your prescription, and you're told to come back later. At the Medicine Center Pharmacy, you don't have to wait. We can fill your prescription in 15 minutes or less, and we could even save you some money on your prescriptions. Talk to your Medicine Center pharmacist at any one of our locations in Canton, Louisville, Minerva, and New Philadelphia. Visit MedShopRx.com for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
Welcome back to Health Matters with the Medicine Center Pharmacy. We are today talking with Dr. Ramaiah, and we are got to get on the here. So, final question for me, I think. What is it seems to me that the progress of reconstructive surgery has jumped way forward in the last few years. Is that correct? Breast reconstruction?
Oh, yes, definitely, especially with the increase or the improvement in genetic testing. There have been more women coming forward that are reaching out for preventive surgeries. And even our women that have breast cancer that are undergoing surgery, they will seek the services of a plastic surgeon ahead of time to plan their surgery and reconstruction almost at the same time as a surgical therapy for breast cancer. Okay. So it is a big thing, yes. Okay. In fact, we have, and some of these reconstructive procedures are quite innovative and very, they provide a very natural result, and women are really benefiting from it.
Well, we went through this period where breast enhancement and all, they were using silicone, and that was bad, that was absorbed and all that. What sort of material do they use now?
Silicone is still used. I think they've improved the capsular materials that the silicone is encased in.
It couldn't leak, okay.
And then, but more and more, I think plastic surgeons have a more of a, what should I say, they lean towards the saline implants, I think.
Yeah, okay.
All right, Doctor, you have a special offer and message you want to share with the listeners, so I'm going to turn the floor over to you.
Thank you. So one thing that really struck me was that there was such a lack of awareness of this procedure, the Mona Lisa touch, especially considering the long-lasting and the long-reaching benefits, including amongst some of my colleagues and also my oncology colleagues who were not aware of it or were very skeptical about it. And so I am very pleased to bring this to the show today, and I encourage and I welcome women to call the office, come to the office in the privacy of my office one-on-one. We can discuss this together. I can assess and see if this is a suitable option for you. And there's no pressure, no commitment, no charge. And again, you don't have to change your gynecologist to have this procedure. I will send full reports to both your primary care physicians as well as your gynecologist so they know what's going on, totally transparent. But I am excited because I'd like to, as a special offer a 10% or a $180 discount to the listeners on this show today. if they are willing to undergo this procedure and pay for it in the month of May as a special offer. And again, you're welcome to come in and talk and see if this is something that is a suitable option.
So they can contact you for a no-charge consult and get more information about it. Can you give your phone number?
Sure. It's 330-452-9900. And I also have, you can make online appointments through the website as well at www.ramaiahgyn.com.
One of the things we talked about, you touched on earlier in the show, was having an evaluation before things got to become too much of a problem, and prevention is key. Can you touch on what really your recommendations are for women to take care of their health on an annual basis, and what you really feel help you do your job better to help patients?
You know what they say about prevention being better than a cure? That is extremely, extremely important for women. And women through the ages always put themselves before everybody else around them, and you see this trend as early as in the teen years where, women are basically people pleasers. And so they try to do everything for everybody else and really not focus as much on their own well-being. Well, it's kind of like the analogy of the, when in the airplanes, when the cabin pressure drops, the stewardess says, well, use the oxygen mask for yourself first before you offer it to your youngsters around you. And this is very true for life in general as well. If we as women do not take adequate care of ourselves, we are not of any use to any of our loved ones or even to ourselves. And so prevention starts early on in life this varies by decade of life, starting in your teen years, in your 20s, 30s, 40s, and so forth. But the bottom line is to make sure that you're getting adequate nutrition, that you're limiting the use of processed foods. So, have some kind of a rule where, okay, I will do fast food maybe once a week or once a month, something like that. And everything in moderation, adequate sleep, definitely limiting the use of social media, technology, etc. And also, as Brad mentioned earlier, something for your mental well-being, be it mindfulness, yoga, meditation. We have a lot of new apps available also. There's a Breathe app that I personally use 6 or 7 times out of the day, just kind of like a time in. And so this is all part of ongoing maintenance for our bodies in terms of managing stress and managing the daily bombardments that we get hit with every day. And in addition, for women's health, in terms of prevention, periodic Pap screening, STD screening, and as well as mammograms are key. And one of the things that I think in older women also is that we forget that we are more likely to develop osteoporosis, so bone density screening is also essential. Mm-hmm. So these are some of the, in common, these are the,
we seem to be bouncing around the age when women should start to get a breast cancer screening.
So there is some lack of consensus even amongst the different medical societies. Definitely we know that after the age of 40, women should be getting annual breast cancer screenings. And what I do in my practice is between 35 and 40, just because of the early age of some of my breast cancer patients, I will offer a baseline screening mammogram. Unfortunately, most insurance companies are covering it, so it is. This is one of the good things about probably Obama healthcare, where preventive screening maintenance is being covered by insurance companies more and more. And breast cancer screening mammograms, people can think that mammograms are actually deleterious because of the radiation, but truth be told, it's actually a very minuscule amount of radiation that you receive compared to even walking out in the sunshine.
Is there not some new or more sophisticated equipment?
So in some women, and depending on the breast exam, etc., and the family history, there is something called breast tomosynthesis, which is a 3D mammogram, and basically it sounds very high tech, but it's basically taking additional images of the breast and constructing a digital image, which makes it much more effective in being able to pick up minute, small areas of breast cancer that would otherwise have been missed using 2D traditional mammogram.
We're almost out of time. Anything you'd like to
I want viewers to know that they can empower themselves, that they have solutions in their hands, and we are living in one of the best countries in the world, and we have all the resources in our hands. And so reach out there and make today the best day ever, and going forward every day of your life, make it the best ever. It's all in your hands. Thank you.
Is healthcare in Sweden better? That's what I always hear, is so much better.
It's probably, I think it's cheaper, but I don't know if it's better.
Yeah, okay. All right. Thank you very much, Dr. Ramaiah, gynecologist and robotic surgeon from Total Women's Care. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you right here again next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.